I think the
Mhm.
general populace, when you hear skilled versus private pay, people get confused. What does skilled mean?
Yes, and I think something very important to mention is, and it's a call that we get almost every single day in our office, is a lot of clients that are calling, they think that their insurance is going to pay for a home health aide. Unfortunately, that is not the case.
Right, right.
Right.
And it's hard sometimes because they've called their insurance company and they're like, I just spoke with Aetna and they just told me this and I'm a stranger to them. So
Sure.
for them calling me, I'm like, I know I'm a stranger to you, but I promise you this is the correct information. And
Mm.
what the insurance companies are saying is home health, not just home health aid services. So through insurance, they could receive physical therapy, occupational therapy, a visiting nurse, sometimes a couple of hours of a home health aid, maybe once or twice a week, but only for bathing purposes. So they'll come in, they'll do a shower, they'll do a sponge bath, they'll do a bed bath, whatever the client needs, but then they're out the door because they got to get to their next client. And that's not guaranteed because insurance doesn't deem home health aides as medically necessary.
And we're including Medicare in that when you say
Exactly.
insurance.
Exactly. So Medicare, we in New Jersey, we actually have a office that helps with commercial insurance visits too, which is pretty unique. They can also do private pay visits from a nurse or a therapist. That office is actually in Morristown, we were
Mhm.
just talking about. So they are able to provide that support. That's where we get a lot of confusion in the calls. And unfortunately, they think insurance is going to pay.
Sure.
They will not. They'll pay for those visit services, but they're not going to pay for strictly a home health aide.